everyone, this is the video for bone tumors. Now before we start, I just want to say a couple of things. So this video might be a bit lengthy because I'm going to go over all the tumors, and I'm going to go over some questions at the end to help you see how to answer the questions. Also, this video is not going to be 100% inclusive of everything in the lecture, so please go over the lecture because I have not included some stuff like histology because I don't like histology. Okay. And also, please watch the sketchy video for this lecture because it helped me quite a lot, and I hope it helps you as well. So let's get started. Okay, so first we have benign tumors. We have two very closely related tumors, which are osteosarcoma and osteoblastoma. Osteosarcoma is this small tumor that you see here on the radiology picture. The very characteristic thing about it is that it causes pain at night, which is relieved by aspirin. Very important. And it usually shows up in the metaphysis of long bones or the diaphysis, okay? Usually in middle-aged or in younger patients. Osteoblastoma is very similar except that it's a bit bigger. It arises in the vertebrae and the pain is not relieved by aspirin, okay? Osteochondroma is this benign tumor of bone and cartilage from the name, and it's characterized by this stalk that you see here in this picture, and then it's bone and covered by this sort of cap of cartilage, okay? Mushroom shaped, very characteristic. You also see it here in the radiology and also in these two pictures, okay? It's the most common benign tumors of the bone. Osteoma, I have not really described it that well, so please check the lecture, but it's basically this tumor which you see in elderly male usually in the cranial bones, so in the skull, and it's described in the picture as you see like an exophytic sessile mass, okay? Enchondroma is a tumor of the cartilage, usually hyaline cartilage, and the most important thing is that it arises in the bones of the small hands and feet, so in the phalanges, okay? And the histology you can see here, it's these chondrocytes which are in this lacunar space, okay? And it's blue because it's cartilage. So that's it for benign tumors. For malignant tumors, you have osteosarcoma. Osteosarcoma is the most common malignant tumor, and it can either be primary or secondary. So primary means it has no predisposing cause. It usually arises in the second decade of life, so they would say like 15 or 18-year-old, and usually due to a genetic mutation like mutation in P53, and it comes in the long bones, okay? So secondary bone tumors, or secondary osteosarcoma, usually in adults, and it's due to a predisposing condition, which most commonly they would say Paget. So in the question they would describe for you a Paget's patient, and then the question would be like, which complication would you expect here? And the answer would be osteosarcoma, okay? Osteosarcoma is described like this large bulky mass, mutton leg, grayish white, okay? And in the radiology, this is the most important thing. You're going to find two different findings, which first of all, you have the sunburst appearance. So as you can see here, it kind of looks like a mass of destroyed bone basically. And the other one is Codman's triangle, which you see here. Codman's triangle, the reason it happens is because imagine you have this bone and there's a tumor here, okay? So the tumor outgrows, and the periosteum around the bone, it gets lifted up with the tumor, you know? So this is sometimes called the periosteal reaction also, okay? And it's also called Codman's triangle. Other things this tumor can cause are pain and pathological fracture. Okay, so giant cell tumor is also known as osteoclastoma, and it helps you remember the presentation or the clinical picture or the radiological picture, because it looks like a mass of destroyed bone basically, and there's this thin layer of bone around it, you know, because it's being destroyed from inside. So the most important thing is that it occurs in females more than males, and also it has a soap bubble appearance, which you see in the picture. Very important. Next you have Ewingssarcoma. So Ewingssarcoma is a tumor usually seen in children in the diaphysis, in the medullary cavity, so inside the bone. Usually they would say in the biopsy they found small round cells or pseudorosettes, which are usually dark blue or purple. Very important presentation is fever, okay, fever and pain. It's also associated with translocation 11 to 22, which I'm not sure if it's in the slides, but just know it because it comes in the question sometimes, okay? The radiology is described as onion skin appearance, which you see here. It's like thin layers of bones over each other. It's also called hair-on end appearance, okay? Chondrosarcoma is a malignant tumor of the cartilage. It can be either primary or secondary, usually in adults. And the most important thing to know is that it comes in the axial skeleton, usually the pelvis, okay? They will tell you in the question the pelvis. Macroscopic picture you see here, it's like a large lobulated mass, bluish white, of course, because it's a cartilage. And in the radiology here, you can see it kind of destroys the bone around it and erodes tissue, okay? So lastly, the locations of the tumors. So if we go to the diaphysis first, so diaphysis, the most important ones to know are Osteosarcoma and Ewingssarcoma, okay? The rest here you have not taken, so just ignore them. In the epiphysis, you have giant cell tumor. That's the only one that you should know, okay? And then in the metaphysis, you have osteosarcoma, basically everything else, enchondroma, osteochondroma, okay? Also, sometimes osteosarcoma can be seen in the metaphysis, so keep that in mind. Then you also have metastatic bone tumors. I'm just going to go over them quickly. So metastatic bone tumors are actually, funnily enough, more common than actual bone tumors themselves, like primary bone tumors. So it's more common to have a tumor be somewhere else and then metastasize to the bone. And the locations that you should know are the prostate, breast, kidney, lung, and thyroid. Remember these. These are very, very important, okay? So let's go over some questions for bone tumors. I'm going to show you how to answer them. So for example, you have this question here, a 51-year-old man. That's the first clue. And then you have, he has a mass involving the right ischium of the pelvis, okay? Irregular borders, extensive area of bone destruction. And then you have, the lesion is resected and has a bluish-white cut surface. So you can tell from the bluish-white that it's probably a cartilage tumor, from irregular borders that it's probably malignant, and then finally, remember which tumor arises in the pelvis? Right, so that would be chondrosarcoma, okay? Next question, an 11-year-old boy who has pain in his left leg, okay? He has fever. He has a tumor in the diaphysis region. Bone biopsy reveals numerous small round blue cells, and then karyotyping shows T11 to 22. So I hope you remember all these clues and what tumor they mean here. Right, so that would be Ewingssarcoma, okay? Next question, 16-year-old boy who has pain in his left knee. In the proximal tibial metaphysis, which erodes bone cortex, lifting up the periosteum. So what they mean here is a periosteal reaction, aka Codman's triangle. And then they show you atypical cells, blah 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 blah. They're just describing the histological features of the which tumor? Do you know? Right, so that would be osteosarcoma, okay? And then another question, 23-year-old man. If you just skip to the last line and you read this, lesion is excised and is composed of a 3 cm stalk of bony cortex capped by cartilage. You should remember which tumor is capped by cartilage. It's a benign tumor. And from the name, it's a bony cortex with cartilage, so it would be osteochondroma, okay? Finally, you have an 11-year-old boy who has pain, and this pain is worse at night and relieved by aspirin. There's really no need to read further into the question. I think you can already know the answer from here. Right, osteosarcoma. Okay, and then last question. So a 30-year-old man with pain, and this lesion has a soap bubble appearance. Okay, can you guess which tumor this is? Right, so that would be a giant cell tumor. And did you notice something weird in this question? So this giant cell tumor is actually in a male. Remember, I told you giant cell tumor is usually in females, but this does not mean that it cannot appear in males as well. Okay, so keep that in mind. And also this tumor is in the epiphysis. So remember, the only tumor that was in the epiphysis is the giant cell tumor, okay? So that's it for bone tumors. I hope I made it simpler for you, and if you have any questions, please do let me know, okay? Thank you.